Low oxygen levels in your body can show up in surprising ways that might not seem connected at first, but they reveal significant insights into your health. From unusual respiratory changes to unusual feelings in your hands or feet, these indicators might be subtle or prominent. However, they all lead to one problem. Your body isn't getting enough oxygen to perform correctly. Oxygen powers every cell in your body, so when levels drop, the effects spread across numerous systems, often showing up as symptoms that are simple to overlook. Signs like headaches or dizziness could appear like little difficulties, while others, such as a bluish skin tone or abrupt bewilderment, could suggest something more serious. In this video, we'll cover 12 rare but crucial indications of low oxygen levels. You'll discover how these symptoms connect to oxygen limitations, what they indicate for your health, and why detecting them early can help avert worse problems. By the end, you'll know how to recognize these warning signs and what steps to take to protect your health. Rapid heartbeat. When oxygen levels decline, the heart beats faster to keep oxygen flowing to essential organs. This condition, called tachycardia, is one of the body's earliest responses to low oxygen. While a higher heart rate helps circulate blood, it also puts greater stress on the heart and blood vessels. Tachycardia from low oxygen can feel like your heart is racing or beating, even when you're resting. Sometimes, it might produce chest discomfort or feelings of anxiousness. It's common in persons with chronic illnesses like COPD or heart failure, and can sometimes arise unexpectedly owing to complications like lung blood clots or severe infections. If the heart keeps working harder without enough oxygen, it increases the chance of problems such as abnormal heart rhythms or cardiac failure. Persistent fast heartbeats, especially when accompanied with weariness, dizziness, or shortness of breath, should not be overlooked. Treatment focuses on improving oxygen levels by utilizing oxygen treatment, resolving breathing issues, or managing heart diseases. Early therapy can minimize the strain on the heart and prevent more serious complications. Excessive sweating. Sweating a lot, especially when it's not related to heat or exercise, can be a symptom of low oxygen levels. This happens because the body is stressed and releases adrenaline, stimulating the sweat response. Instead of helping the body chill down, sweating, in this scenario, is commonly combined with restlessness or discomfort. Cold, clammy skin is a common symptom of this sort of sweating, signaling that the body is working hard to deal with the lack of oxygen. It generally occurs with quick breathing or a fast heartbeat, as the body prioritizes supplying oxygen to important organs. People with conditions as asthma or COPD could experience rapid sweating during flare-ups, while those at high altitudes or exposed to carbon monoxide may notice it as an early warning. In severe circumstances, profuse sweating might point to hypoxemic shock, where oxygen deprivation begins to damage organ function. This could also include pale or blue skin, as blood is redirected from the skin to more essential places. Sweating, along with other symptoms, can suggest the need for urgent medical attention. Treating the core cause of oxygen deprivation, whether through oxygen therapy, medicines, or other therapies, is important. While sweating might seem insignificant, it often shows the body's genuine effort to cope with an oxygen shortage. Cyanosis. Cyanosis is when the skin, lips, or nails take on a bluish color, suggesting that oxygen levels in the blood are too low. This happens when blood has too much deoxygenated hemoglobin, a type of hemoglobin without oxygen, giving tissues a blue tinge. It's especially visible on the lips and fingertips, but can also form on thin-skinned places where blood vessels are close to the surface. In mild situations, the hue may look more grey or light than blue, which can make it harder to spot. People with darker skin tones could not see the bluish color easily, but it commonly shows up in the mucous membranes, such as the inside of the mouth or eyelids. Cyanosis can have several causes. Sudden cases could come from choking, drowning, or a severe asthma attack where oxygen intake is blocked. Chronic issues, such as COPD or certain heart abnormalities, can potentially lead to persistent cyanosis. In babies, it can imply circumstances like congenital heart disease or breathing issues, which need rapid attention. The speed and severity of cyanosis provide key indicators. If it happens suddenly, it could signify a dangerous illness like a pulmonary embolism, when a blood clot inhibits oxygen from reaching the lungs. Gradual onset may lead to long-term concerns, including deteriorating heart or lung illness. Cyanosis always necessitates rapid response. Medical treatment, such as oxygen therapy or addressing the root problem, is crucial to prevent more difficulties and ensure tissues receive enough oxygen. When oxygen levels in the blood decline, the brain, one of the most oxygen-dependent organs, can start to exhibit clear impacts. Confusion or memory loss often happens because the brain isn't getting enough oxygen to perform its usual tasks, such as thinking, focusing, and remembering information. The impact might range from simple forgetfulness to more severe difficulties, such as difficulty making decisions or following simple guidelines. Early signs may include problems recalling recent events, finding the proper words during conversations, or feeling lost in familiar settings. In more severe situations, someone could seem dazed, not identify individuals or surroundings, or fail to understand what's happening. This symptom is usually associated with illnesses including COPD, sleep apnea, or acute difficulties such as carbon monoxide poisoning. People at high elevations, if oxygen levels are lower, may also feel confusion as part of altitude sickness. These examples demonstrate how crucial oxygen is for clear thinking and brain function. One unexpected indication of low oxygen levels is a sense of exhilaration or feeling disconnected from reality. This happens when the brain isn't getting enough oxygen, but the body compensates by generating hormones like adrenaline. This short rush can produce sensations of delight or an odd sense of being divorced from what's happening around you. Although it might seem innocent, this state is hazardous since it can mask how serious the problem is. People may feel excessively confident or fail to recognize other warning flags, such as difficulty breathing or a quick heartbeat. This is typically noticed in altitude sickness, when climbers express a quick sense of elation or enthusiasm right before their condition worsens. The brain's chemical response to low oxygen can be misleading. While it could bring a brief sense of peace or relief, prolonged oxygen deprivation can cause catastrophic injury, including fainting or even seizures. 6. Visual problems. Low oxygen levels might cause vision issues, commonly disregarded as a symptom. The eyes rely on a continuous oxygen supply, especially the retina and optic nerve, which are susceptible to oxygen deficits. When oxygen levels decline, certain pieces may stop performing effectively, leading to temporary or chronic difficulties. Blurred vision is frequently the first indicator, such as difficulties focusing, a hazy view, or problems seeing things clearly at the corners of your vision. Some folks may also notice spots or flashes of light, akin to migraine auras. In severe circumstances, tunnel vision, where only the center of your vision is clear, or brief total vision loss may occur. These difficulties might better if oxygen levels return to normal, but can come back if the primary reason isn't handled. Oxygen shortages limit blood flow to the eyes, making it harder for the retina to convey visual signals to the brain. Prolonged lack of oxygen can damage the visual nerve, resulting to permanent eyesight loss. Conditions like COPD or sleep apnea can produce chronic visual abnormalities, while abrupt episodes can occur with carbon monoxide poisoning or at high elevations. 7. Feeling lightheaded. Dizziness. Feeling lightheaded or dizzy is an early indicator of low oxygen levels. The brain needs a steady supply of oxygen to maintain balance and orientation. When oxygen is decreased, it strives to keep up, resulting to unsteadiness or a whirling sensation. This can come suddenly and is generally worse when rising up rapidly. Severe oxygen depletion can potentially cause fainting or losing consciousness. People with disorders including anemia, lung diseases, or heart difficulties often feel dizzy because their blood can't carry or deliver enough oxygen to the body. The brain and inner ear, which controls balance, both have a role in this symptom. When oxygen levels drop, the brain sends blood to crucial organs, limiting blood supply to less critical systems like the inner ear. This breakdown in balance signals causes dizziness or vertigo. Chronic dizziness might signify long-term oxygen deficits prevalent in situations like pulmonary hypertension or heart failure. Sudden occurrences, however, could hint to major conditions like carbon monoxide poisoning or high-altitude sickness. Feeling drowsy. Feeling consistently fatigued or drowsy can suggest insufficient oxygen levels in the body. When cells don't obtain enough oxygen, their ability to make energy drops, resulting to a sense of fatigue that doesn't alleviate with rest. This isn't the ordinary fatigue, but rather a constant tiredness that makes even routine everyday tasks feel daunting. Muscle weakness commonly arises with this symptom, since muscles rely on oxygen for energy, especially while activity. Without enough oxygen, recuperation slows down, and muscles may feel heavy, painful, or achy. Mentally, insufficient oxygen can cause trouble focusing, staying awake, or executing actions that generally involve minimum effort, like reading or talking. Long-term weariness is typical in patients with illnesses including COPD, sleep apnea, or cardiac failure. These factors reduce how effectively oxygen is given to the body, resulting to continuous low energy. In unexpected cases, such as during a respiratory infection or during high elevations, weariness can soon turn into sleepiness that worsens if addressed. Addressing the root cause, whether through supplemental oxygen, medical therapy, or lifestyle modifications, can help lessen weariness. Recognizing this sensing early is vital since long-term low oxygen might create more severe health concerns. Nausea or vomiting. Low oxygen levels can upset the stomach and cause nausea or vomiting. Like other organs, the stomach and intestines require oxygen to perform correctly. When oxygen levels decline, the digestive system begins stressed, leading to these symptoms, which are commonly misunderstood for unrelated conditions. Nausea can also happen because of oxygen deficiency in the brain, especially in the vomiting center, a region of the brainstem that governs nausea and vomiting. If this area doesn't get enough oxygen, it can elicit these reflexes even without stomach-related disorders. Vomiting could occur as the body's way of correcting the imbalance. While nausea is terrible, recurrent vomiting can induce dehydration, making it significantly tougher for the blood to transfer oxygen. Treating this condition involves rehydration and restoring oxygen levels. If nausea or vomiting happens alongside exhaustion or respiratory concerns, obtaining medical attention is necessary to address the underlying problem. Feeling tingling or numbness in your hands, feet, or other extremities can suggest low oxygen levels. This happens when oxygen limitations impair how nerves and blood flow work in these areas. Nerves need oxygen to deliver messages effectively, and without enough, communication between the brain and the damaged regions gets disrupted. It frequently starts with a slight pins and needles sensation, but can progress to profound numbness if the oxygen deprivation continues. Poor circulation, which is common in persons with heart or lung concerns, makes this worse. Fingers and toes are most sensitive since they are farthest from where oxygen is absorbed and circulated. Tingling and numbness are also prevalent in situations of carbon monoxide poisoning. This inhibits oxygen transport to tissues. At high elevations, these sensations may suggest diminished blood flow to extremities due to poor oxygen availability. Treatment involves boosting oxygen supply and circulation, utilizing techniques like oxygen treatment, healthier posture to support blood flow, or addressing underlying health conditions. Headaches are a typical indicator of low oxygen levels but are often neglected. When the brain doesn't get enough oxygen, blood arteries enlarge to try to boost oxygen delivery, producing pressure fluctuations that produce discomfort. These headaches can range from mild pains to severe throbbing pain and are commonly misinterpreted for tension or dehydration headaches. Because the brain is very sensitive to oxygen deficiencies, headaches are an early warning symptom of hypoxia, poor oxygen. Ignoring them can lead to more severe symptoms like confusion or fainting. Rapid breathing. Fast breathing, rapid breathing, or tachypnea arises as the body tries to make up for low oxygen levels by raising the breathing rate. It's the body's means of giving more oxygen to important organs and tissues. People experiencing tachypnea frequently breathe fast and shallowly. This doesn't enable enough oxygen to be exchanged in the lungs. This can lead to hyperventilation, where too much carbon dioxide is exhaled, causing lightheadedness, tingling in the hands and feet, and further issues with oxygen delivery. Chronic respiratory diseases like asthma or pulmonary fibrosis can produce tachypnea, as might abrupt concerns like illnesses or high-altitude exposure that impede lung function. In toddlers, fast breathing can be an early symptom of significant respiratory or systemic illnesses and needs urgent attention. Tachypnea can be taxing and may increase other symptoms of low oxygen, like weariness or bewilderment. Treatment requires regulating oxygen levels using supplementary oxygen, breathing support, or treating the underlying condition. Thanks for watching. If you found this video helpful, let us know by giving it a thumbs up. Don't forget to hit subscribe and put on notifications so you won't miss out on additional videos like this. We'd love to hear your opinions. Please share your experiences or questions in the comments below. Stay healthy, stay educated, and we'll see you in the next video.